Everyone's had a sore throat at one time or another, and most of the time, with a little TLC, it goes by itself. Sometimes though, it gets really bad or it goes on for ages and we can't eat or drink and we need a little help. A sore throat is exactly that, soreness in your throat. It's a symptom, not a disease, and loads of things can cause you to have a sore throat. But if you think about all the times you've had one in your life, it's probably going to be due to the same cause, an infection. Yep, it's super common and easy to get an infection in your throat. When we say throat, what we really mean is one of the 4 regions in your upper respiratory system, the pharynx, larynx, tonsils, and the epiglottis. Most sore throats occur in the pharynx and the tonsils. Sore throats are mostly caused by viruses, such as the one that causes the common cold, influenza, or glandular fever. Some are caused by bacteria, and the commonest is called streptococcus, or strep throat, and it makes up about 20% of sore throat in kids. Most of the time you won't need to see anyone or your pharmacist can help you. In my practice of about 4,000 patients, I see about 250 cases of sore throat per year, almost one a day, with most being in kids and young adults. You should see your GP about your sore throat if it doesn't improve after a week. Most should have got better by then, or you get recurrent sore throats. This is when you have 5 or more per year that affect your normal ability to function. If you have a weakened immune system, for example due to diabetes or medications or chemotherapy, or you're just worried and you can't manage the symptoms. In the UK, we don't do routine throat testing, as most cases are often better by the time we get the results back. Occasionally though, if you're not getting better or symptoms keep returning, or there's another clinical reason why we need to know which germ is causing the sore throat, we sometimes send a throat swab to the lab. It's the same for blood tests too. They aren't done routinely in the UK for a straightforward sore throat infection. In some rarer cases, we may do a blood test if there are concerns about the strength of a person's immune system or to confirm the diagnosis of a specific disease like glandular fever. One thing that's usually going on in my head while I'm listening to your story and gathering info is figuring out whether the infection causing your sore throat is viral or bacterial. This is important as it really helps with management, especially whether antibiotics are needed or not. One tool that we often use is the Centaur criteria. The Centaur criteria looks for 4 different things: pus on your tonsils, do you have tender lymph nodes at the front of your neck, is there a fever over 38 degrees, and is there the absence of a cough, i.e. no cough should be present. Each of these criteria scores 1 point with a maximum score of 4. The higher the score, the higher likelihood that you've got a bacterial infection that's causing your sore throat. If you have a score of 3 or 4, then there's about a 50% chance that you have a bacterial strep infection and that antibiotics may be helpful. On the flip side though, if you've got a score of 0 or 1, then you have an 80% chance of a viral cause to your sore throat. We do use scoring systems like this a lot, but it's just a guide. More important is clinical judgment and other parts of the history, like a tongue examination, which may suggest a bacterial infection like scarlet fever. After ruling out more worrying causes of sore throat, we need to think about management. Often patients are keen on having antibiotics and are wondering if they need an antibiotic or not. In most instances, you won't need one. This is because most throat infections are viral and antibiotics don't treat viruses, your immune system does. Even if you have a bacterial infection, your immune system is good and it can often fight these too and clear them within a few days. Either way, with or without antibiotics, some other things to consider are prioritizing fluid like cool water to prevent dehydration. Hot drinks can sometimes make the pain worse, but some people do find them soothing. Take paracetamol or ibuprofen to ease pain, headache and fever. It helps to take these medications at regular intervals rather than ad hoc, as they work better that way. Lozenges can also help to soothe a sore throat, and some people also find sucking boiled sweets, ice, or even ice lollies can be useful too. There are some gargles and sprays that you can buy over the counter that some people find helpful. They tend to work by numbing the affected sore area and can be helpful. In nearly all cases, a sore throat or tonsillitis clears up without leaving any problems. However, occasionally a typical sore throat may progress to cause complications. Also, a sore throat is sometimes due to an unusual but more serious illness. Therefore, for the sake of completeness, the things to look out for and to speak to your GP about include co-infection. Sometimes the infection can spread from the throat or tonsils to other nearby tissues. This is much commoner in kids than adults and often just prolongs the symptoms. Glandular fever. This is caused by a virus that causes recurrent severe bouts of tonsillitis, neck swelling and tiredness, and requires review, sometimes a blood test to confirm the diagnosis, and a very specific treatment. Quinsy. This can occur after a tonsillitis where an abscess forms next to a tonsil due to a bacteria. It usually affects one side of your throat rather than the whole throat, and it's really painful. If you've had a sore throat beyond 7 days, this could just be a common virus taking longer to heal, but it's important to exclude any other causes, such as thrush infections or growths. The take-home messages are sore throats are common, are almost always caused by an infection, and can usually be managed at home. Do see your GP if your sore throat hasn't improved after a week, or if you keep getting sore throats, or you have a weak immune system. If you have a sore throat and have difficulty swallowing or breathing or are drooling or are making high-pitched wheezing sound as you breathe, then you should call for emergency help. Most sore throats are caused by viruses, but some are bacterial and may benefit from an antibiotic, especially if the infection is severe or your immune system is weak. Most sore throats don't need antibiotics though, but do benefit from rest, pain relief, fluids, and sometimes lozenges and sprays. Thanks for watching. Till next time, stay healthy.